hit record. I wanted to thank everyone for coming out tonight. As a functional medicine practitioner at Back to Nature Lifestyle Medicine, both I and my husband pride ourselves on providing patient-centered care, and we are motivated to help others achieve better health and wellness with natural, holistic techniques that allow the body to heal itself. For those of you that don't know us, I am Tiffany Roberts. My husband and I own a functional medicine clinic in Prairie Village, Kansas, called Back to Nature Lifestyle Medicine. And you can check out the website that we have at functionalmedicinekc.com. If you have any questions during our time together tonight, please feel free to post them in the chat, and I will do my best to respond to them quickly. Before we start to discuss management techniques, let's talk about the conditions and symptoms of arthritis. All right. Okay, so arthritis is not a single disease, but the term referring to various conditions of joint pain and joint diseases. So after arthritis really affects people of all ages, genders, and races, and is a leading cause of disability in America, as more than about 50 million adults and 300,000 children have some type of arthritis. There are actually over 100 different types of arthritis and related conditions, and the most common types include osteoarthritis, rheumatoid arthritis, psoriatic arthritis, fibromyalgia, gout, lupus, and there's many, many more. So let's start with osteoarthritis. It's called a degenerative disease, arthritis, and it's the most common form of arthritis known. Cartilage is a firm, slippery tissue that supports smooth joint motion. Osteoarthritis occurs when the protective cartilage on the ends of the bone wear down over time, leaving bone rubbing on bone. Osteoarthritis can damage any joint in the body. However, the joints in the hands, the knees, the hips, and the spine are more frequently affected. Common symptoms which develop over a long period of time, that includes pain in the joint during movement, joint tenderness when pressure is applied, excuse me, stiffness following periods of inactivity. So if you're sitting for a while and you're getting back up, it kind of is really, really stiff. Loss of motion, range of motion, grating sensitivity, or like a sensation in the joints when you move. Bone spurs can form around the affected joint. So common risks, risk factors for that, risks increase as you age. Women are more likely than men to develop this condition. If you carry extra body weight, it kind of stresses the joints. Sports injuries, certain occupations with repetitive stress on the joint can cause this. So osteoarthritis pain, it's commonly associated with a loss of cartilage causing bone to rub against bone. However, there are other conditions which can cause this pain. Bone microfractures occur when the cartilage is lost, placing stress on the bone, resulting in a bone bruises or tiny fractures. Osteophytes or bone spurs are small bony growths that occur on the sides of the joints. Joints are aligned with membrane or liquid called synovial fluid. This helps the joints move smoothly. When this lining becomes inflamed, too much fluid can build up, leading to synovitis. Joint pain often leads to being more inactive, which, it makes you want to not move. And this leads to muscle weakness. Weak muscles will place additional stress on the joints, just simply because you don't feel like moving. But if that muscle is not built up, it's going to cause a lot more stress on that joint. Ligaments are bands of tissue connecting bones together. Damage to the ligaments is also common in osteoarthritis. Rheumatoid arthritis. This is an autoimmune disorder where your immune system mistakenly attacks healthy body tissue, causing chronic inflammation. This form of arthritis affects more joints, more than just joints. It's also damage to other systems of the body, such as your skin, your eyes, your lungs, heart, and even your blood vessels. So bone erosion and joint deformity can be caused by painful swelling and the joint lining, and is not associated with wear and tear damage that osteoarthritis is associated with. The actual cause of rheumatoid arthritis is still unknown in the medical community. However, genetics is thought to play a role. Although genes don't actually cause the disease, genes can make you more susceptible to the environmental factors that you're exposed to, such as infection, which certain viruses and bacteria, this can trigger rheumatoid arthritis. The disease typically starts in small joints, such as your fingers and your toes, and they progress to wrists and knees and ankles, elbows, hips, and shoulders. Symptoms generally occur in the same joints on both sides of the body, and they include tender, warm, swollen joints, joint stiffness that is usually worse in the mornings or with inactivity. You have fatigue. You might have fever or weight loss. So things to keep in mind. Women are more likely to develop this condition than men, although men can develop it. It can occur in any age, but most commonly between ages of 40 and 60. You have a family history. If you have a family history, this can increase your risk for this. Smoking increases the risks in disease severity. So if you smoke and you have a risk for this and you develop it, you can become more severe than a non-smoker. Environmental exposures such as asbestos and silica may increase the risk. Obesity can increase your risks in this as well. So let's talk about psoriatic arthritis. Psoriatic arthritis is an autoimmune inflammatory disease, and this affects some people who have psoriasis, okay? The abnormal immune response leads to inflammation in the joints in addition to overproductive skin cells. Genetic and environmental factors play a role in the development of the condition, as certain genetic markers have been identified which are associated with psoriatic arthritis. And this is like a viral or bacterial infection that may trigger psoriatic arthritis in people with an inherited tendency. We've seen other issues, even fungus as well. Symptoms can worsen over time with alternating periods when symptoms go into remission or worsen. Symptoms often resemble rheumatoid arthritis but affect both sides of the body or just one side of the body. Psoriatic arthritis is more likely to cause swollen fingers and toes, foot pain, lower back pain. You might have joint stiffness that is usually worse in the mornings, and with an activity. There are common risk factors for this. If you have psoriasis, then you have a risk factor of developing psoriatic arthritis. If you have a family history, and age, again, most often occurs between the ages of 30 and 50. Fibromyalgia. This is considered a central pain syndrome, meaning the brain and the spinal cord process pain signals differently. Researchers propose that fibromyalgia magnifies pain sensations by affecting the way that your brain processes your pain signals. Other symptoms common with fibromyalgia sufferers include tension headaches, temporal mandibular joint, TMJ, disorders, irritable bowel syndrome, anxiety, depression. Symptoms can gradually accumulate, or you could have a trigger event, such as a physical trauma, surgery, infection, or significant psychological stress. So fibromyalgia can be difficult to treat because there's a lot of different things that can cause fibromyalgia. Symptoms include widespread pain, such as constant ache that just lasts for months at a time on both sides of the body, both below and above the waist. Fatigue, in a major symptom, feeling tired even after long sleep periods. Cognitive difficulties. Apparently I need a little help here too. This can impair the ability to focus or pay attention to mental tasks. So keep in mind, this affects more women, again, more than men, but men can also get it. There are higher risks when you have a family history. Other disorders such as osteoarthritis, rheumatoid arthritis, or lupus can increase the risk of this. So gout is a common and complex form of arthritis, but it does not cause body-wide inflammation. Okay, gout can be characterized by sudden, severe attacks of pain, swelling, redness, and tenderness in the joint, most often the joint at the base of the big toe. Okay, gout results in the accumulation of urate crystals when the body produces too much uric acid or cannot remove excess of that uric acid fast enough. Uric acid is the product from the breakdown of purines, which are found in foods such as steak, organ meats, seafood, and alcoholic beverages. Uric acid normally dissolves in blood and passes through the kidneys to be excreted through the urine. When this process is disrupted, uric acid can build up, forming sharp, needle-like urate crystals in the joint or surrounding tissues that cause pain, inflammation, and swelling. Sudden symptoms occur suddenly, oftentimes overnight, and can include intense joint pain, usually in the big toe, ankles, knees, elbows, wrists, and fingers. Pain is most severe within the first 12 hours. However, discomfort can last up to, weeks later. Inflammation or redness in the affected joints. You have limited range of motion. There's common risk factors that include, they occur frequently in men and postmenopausal women. Diet rich in meat and seafood And drinking beverages sweetened with fruit sugar or fructose, even artificial sweeteners. Obesity can cause this. Untreated high blood pressure or chronic conditions such as diabetes or metabolic syndrome, or even heart and kidney diseases. Excess alcohol can cause this, or even a family history of it. So lupus. Lupus is a systemic autoimmune disease where inflammation can affect many different body systems, including your joints, skin, kidneys, blood cells, brain, heart, and lungs. Lupus most likely develops from a combination of genetic and environmental factors. This cause in most cases is unknown. However, triggers include sunlight, infections, and certain medications. Lupus mimics other ailments, making it difficult to diagnose, and there's no two cases that are exactly alike. The most common signs include fatigue, fever, joint pain, stiffness and swelling, butterfly-shaped rash on your face that covers your cheeks and the bridge of your nose, or rashes anywhere else in the body. Skin lesions that appear or worsen with sunlight, so basically photosensitivity. Fingers and toes turn white or blue when exposed to cold and during stressful moments. This is called Raynaud's disease. Shortness of breath, chest pain, dry eyes, headaches, confusion, and memory loss. So you see how this could be a hard diagnosis to come up with. If they can't find out any other reasons why you have these symptoms, then they label it lupus. You have risk factors. Again, us women, we're more common to susceptible to this. It usually occurs between the ages of 15 to 45. More common in African American, Hispanics, and Asian Americans. So functional medicine looks beyond the symptoms to uncover the real root cause. Thankfully, research has found a link between gut health and arthritis, and most studies examining the role of gut health in joint pain center around autoimmune diseases such as rheumatoid arthritis, psoriatic arthritis, and lupus. Conventional treatments relies largely on pain-relieving, non-steroidal anti-inflammatory drugs, which disrupt your gut microbiome even further. A plethora of scientific literature connects gut health and joint pain and reveals a strong association between altered intestinal microbials and various arthritis types. Some studies have found depleted levels of Haemophilus species of bacteria and an overabundance of Lactobacillus salivarius. So inflammation can be aggravated by the overgrowth of pathogenic bacteria or a lack of immune-modulating commensal bacteria. Other studies report to finding high levels of bacterium called, let's see if I can get this right, Provatella corpi, and low levels of the genus of bacteria called Bifidobacterium. So you need to have a good plethora of bacteria, and this creates a good gut microbiome. So let's talk a little bit about that. So the gut microbiome, and we talk about this a lot in our practice. The microbiome is a dynamic collection of microbes or bacteria in an ecosystem. In this instance, the ecosystem is your gut, okay? The human body hosts a variety of different ecosystems called microbiomes. The gut microbiome refers to bacteria living along the entire digestive tract, which ranges from your mouth to your anus, most of which are located in your intestines. So gut microbiome is very, very important. Gut bacteria serves a variety of different purposes, okay? It aids in your immune system, which is number one, especially right now since we're heading into the fall season. Breakdown of nutrients for absorption. Again, Dr. Roberts talked about in our past few lectures ago that the food you eat is not for you. It's for your microbes. They have to break it down and absorb it in order for you to absorb your nutrients. It regulates chemicals that communicate with the brain, which affect mood, memory, and sleep. And it regulates hormones to keep the body properly balanced. There are approximately over 400 species of bacteria in your system that make up your gut microbiome. Did you know that a lack of bacterial diversity is called dysbiosis and is associated with various forms of arthritis and other autoimmune diseases? So small bacterial overgrowth, this is also called dysbiosis. While every person is unique and they have their own gut microbiome, the general population shares some commonalities. In fact, across the nations, populations show varying gut microbiomes. For example, people living in the United States are notably different than the gut microbiome living in China, simply because of our diet and our environment. So let's talk about dysbiosis. Did you know that newborns inherit their microbiome from their mother at birth? When the bad bacteria outnumber the good, the result is dysbiosis. Dysbiosis can occur at any stage in our life and occur suddenly or slowly over time. Sudden imbalances are usually the result of infection or use of antibiotics, whereas diet, medications, alcohol use, and smoking can create an imbalance over time. Testing for dysbiosis is not a standard practice in the conventional medicine practices. However, testing gut bacteria is usually one of the first steps when working with a functional medicine professional. Dysbiosis is typically diagnosed by testing fecal samples. Common symptoms of gut dysbiosis include frequent gas, bloating, or belching, loose stools, diarrhea, or constipation, acid reflux, unexplained weight gain or difficult weight loss, irritable bowel syndrome or irritable bowel disease. You have anxiety, depression, or frequent low moods, halitosis, which is really bad breath. You can smell the breath across the room. You have brain fog, joint pain, skin conditions such as acne, eczema, psoriasis, low energy or chronic fatigue, diagnosis of an autoimmune disease such as Hashimoto's, thyroiditis, or rheumatoid arthritis, allergies and food sensitivities, chronic yeast or fungal infections. These are all connected to dysbiosis. So to heal the gut, it is necessary to regain proper bacteria, as beneficial bacteria needs to be restored while problematic bacteria needs to be reduced. So when doing so, improving diet and reducing chronic stress are very key factors in this process to consider. Stress can cause inflammation of the gastrointestinal system and make you more susceptible to infections. It's important to find ways to reduce stress when healing your dysbiosis. Mind-body practices and exercises are also beneficial for stress reduction. The key is to find an activity that you enjoy. Maybe it's dancing or yoga, meditation, or breathing practices. These are all great stress relievers. Maybe it's fishing. Maybe it's, going for a walk or enjoying a nice organo cup of coffee with a friend. This is all stress relieving techniques. Also, keep in mind that the food that we eat has a power to heal or destroy our gut bacteria. So be mindful of what you eat and how you eat. Added sugars, avoid those, such as lots of pastries and things like that. Sugar feeds yeast, and we want to reduce the yeast that is inside of our guts. Sugar goes by many names. Look out for, cane sugar, table sugar, high fructose corn syrup. Absolutely stay away from that. Brown sugar and glucose, artificial sweeteners such as aspartame or sucralose can all negatively influence bacteria in the gut. Natural sweeteners should also be avoided in the initial stages of gut healing. Once you have your gut cleaned out of all the infections, then you can go back to your natural cane sugars, your natural, like as it came from nature sugars, not table sugar, not white sugar, because that's all really not great for you. It's all processed. Refined grains also break down into sugar, and it can feed yeast and other bacteria. So stay away from that. Like breads and pastas, you basically, when you're trying to heal your gut, you want to stick with vegetables and meat, okay? Just as clean as that. It's recommended that 70% of diet comes from your vegetables, as they contain different types of fiber to feed beneficial bacteria in the gut. And foods to eat more of include lightly steamed vegetables, bone broth, organic bone broth, healthy fats such as fatty fish or avocados and coconut oil, and fermented foods such as kimchi and sauerkraut and kefir. These are all fantastic foods to eat while you're healing your gut. So chronic inflammation is one of the major causes of pain associated with arthritis. In fact, a number of foods have been found to increase the body's inflammatory response and should be avoided. These include sugar, vegetable oils found in like mayonnaise and salad dressings, barbecue sauce, crackers, breads, potato chips, fried foods, refined flour, usually the enriched flours, dairy, artificial additives, saturated fats, processed meats, non-organic meats, non-organic hot dogs and bologna and sausage and jerky, trans fats, usually found in your margarine or shortening, baking goods like donuts or cookies and muffins, or non-dairy creamers or frozen pizzas and frostings. You want to stay away from fast foods. If you drive through it, you go past it, okay? Alcohol. Maybe a drink of wine is okay, but you want to avoid regularly drinking beer, wine, or any kind of liquor. The key to consume alcohol is in moderation. And basically for myself and my husband, we don't touch it because it's a self-sabotaging practice. So detoxing is a great way to rid the body of toxins that is responsible for inflammatory conditions associated with arthritis. Poor circulation in joints can occur with arthritic conditions, which cause the areas to become clogged with organic waste and toxins. Again, like the uric acid, it can't get out. Thankfully, drinking plenty of pure water can help flush out accumulated waste. Excuse me. So for an extra boost, try drinking lemon water with fresh lemon juice, and this helps restore, this works to restore good inflammation. In fact, regular consumption of lemon water can improve digestion, detox the gallbladder, and boost liver. And you also add in Celtic sea salt to your water. This helps rid out all those toxins in your body and replaces the good minerals. Also, try adding healing teas to your daily routine, such as, ginger root. Adding some grated ginger root, a teaspoon of turmeric, some fresh peppermint leaves to some pure water. This is a great, excellent herbal tea. So you just boil the water and let the ingredients steep for about 5 minutes before you drink it. So functional medicine programs usually incorporate a plan of detoxification, as a metabolic detoxification provides nutritional support to facilitate the body's natural pathways involved in the processing and excretion of toxins. Detox plans are best when they're personalized by your functional medicine physician. So go back to your functional medicine physician, or if you don't have one, you can always contact our office and we would be glad to personalize, a detoxification plan for you. For most of those plans, there are steps that involve reducing your food triggers, supporting your liver function, using clean eating to lessen the burden of that incoming toxins that you're exposed to, optimizing your gut, your liver, and your kidney function with phytonutrient-rich foods, antioxidants to support detoxification, encouraging healthy elimination, and balancing hormone metabolism, and just taking a closer look at your environment as well, because detoxing yourself, you also want to detox your environment so that you're not re-exposed to those things that brought you to our clinic in the first place. So, your functional medicine doctor will help you create a personalized diet if you need it. Here are some examples of foods that you might want to incorporate into your detox plan. Proteins such as eggs, fish. You want to have wild-caught fish, okay? That's very important, such as halibut and salmon, miso, or, you can even consider organic tofu. Legumes such as black beans and lentils. Good fats and oils such as avocado and flaxseed oil, clarified butter, coconut oil, gluten-free grain, okay, such as buckwheat and millet, quinoa, or even brown wild rice. Dairy alternatives would be coconut, kefir, yogurt, as long as it's grass-fed. Nut milks, we do our protein shakes with organic almond milk. So these are things that you want to think about in your detox plan. Elimination diets are short-term eating plans to eliminate foods causing digestive reactions. Following an elimination period, foods are gradually reintroduced one at a time in order to determine whether or not you can tolerate it well. Elimination diets are beneficial for pinpointing exactly which foods are the culprits for your health-related issues without having to go through lab testing. You can also go through lab testing in order to find out what foods you are sensitive to. Benefits of doing an elimination diet: reduces your inflammation. It supports a healthy microbiome, increases your phytonutrients to heal your gut. It reduces your toxic burden and promotes body awareness to foods. So it's basically helping you train to feel your body. And if something is triggering it, you can automatically know that food was not good for me. So supplementation. Supplements can be useful for returning your gut microbiome back to the normal and for reducing pain associated with arthritis conditions. Some research even suggests to use certain supplements. They may enable you to lower your dose of your prescription medication. That's the whole goal, right? We want to supplement with an herb or something so that we can reduce your medications that's causing toxic burdens. Glucosamine is a good joint supporter. Its positive results for glucosamine supplementation and reducing osteoarthritis pain. Glucosamine can protect cartilage from deteriorating while helping your joints move better. Chondroitin sulfate. Experts believe that chondroitin sulfate can help keep cartilage healthy, slow down osteoarthritis progression, and may lower arthritis pain and inflammation. CME, this is a naturally occurring chemical that has been studied for its effects in pain management. Studies even show that CME may be effective in arthritis treatment as a non-steroidal anti-inflammatory, but in a safer manner. Omega-3 fatty acids. Fish oil, which contains omega-3s, can help treat rheumatoid arthritis, lupus, and other inflammatory conditions. MSM is naturally found in fruits and vegetables and is thought to help form connective tissues in the body and may possibly reduce arthritis pain. Vitamin C, but you want whole food vitamin C, not ascorbic acid. We learned that last weekend in our preparing for winter. Ascorbic acid can actually cause damage in your microbiome. So you want the whole vitamin C. This is a powerful antioxidant and important for building connective tissues. Proteolytic enzymes. These are found to have anti-inflammatory effects because they help improve overall gut health and your immunity. Let's talk about herbal therapies. Ginger. Ginger root is known to improve joint pain and reduce inflammation for people with osteoarthritis and rheumatoid arthritis. It's actually a really good digestive aid as well. Turmeric, this is the potential anti-arthritic effects of the turmeric include inhibition of joint inflammation, reduction in edema and or swelling, and slowed arterial, I don't even know if I can say that, joint pain, okay, joint destruction. Frankincense for my oil team. Frankincense is amazing. You can massage this oil directly into the painful areas and help reduce inflammation. Comfrey can be added to topical creams to help with pain and arthritis. Burdock root, you can add this to your stir fries, or you can add it to an herbal tea. Burdock is amazing. Nettles, so stinging nettles is an amazing herb for all types of arthritis and gout and has anti-inflammatory benefits that is packed with minerals such as boron, calcium, magnesium, and silicon. And this eases pain while helping you build strong bones. Licorice root can decrease free radicals at the site of inflammation and inhibit inflammatory enzyme productions. And of course, my favorite, Ganoderma mushroom. Ganoderma has over 3,200 peer-reviewed studies on many, many different, anything from headache to cancer to gut microbiome. It actually can help rebuild the soil, so to speak, in your guts. So definitely look into Ganoderma or Organo coffee. I know several people out there can definitely point you in the direction for a Ganoderma mushroom coffee that really is amazing. Let's talk about natural therapies. The following alternative and complementary treatments can be used to ease pain and inflammation associated with inflammation. Acupuncture. This involves insertion of fine needles or using pressure points. You can use cupping, things like that, to stimulate specific points on the body. Acupressure uses fingers, knuckles, or palms to apply pressure along the body in certain points. Hot and cold therapy. This helps reduce pain and stiffness caused by arthritis. Massage therapy, specifically, I would say raindrop therapy with essential oils. This definitely helps reduce inflammation. It can help healing process improve. Mind-body therapies such as guided imagery, meditation, visualization, yoga, tai chi. These are all beneficial therapies that you might want to look into. So that was kind of a long lecture tonight. Hopefully you enjoyed it. I really appreciate all of you for taking your time out tonight to join class. And as you can tell, we certainly love sharing natural ways to help aid the body in its own healing process. If you do have further questions, please post them in the chat, and I will try to do my best to answer those for you. Or you can email us at backtonaturelm@gmail.com. You can always visit our website at functionalmedicinekc.com if you have any other further questions or need to reach me after the presentation.